name is Dr.Selvi Radhakrishna. I am an oncoplastic breast surgeon with a special interest in breast cancer. So I qualified from Madras Medical College. My MBBS was in 1988, and after that I did my basic general surgical training in India and in the UK. In the UK I got my FRCS from Royal College of Surgeons, Edinburgh in the year 1993, and I worked there until 1995 and came back to All India Institute, where I received some specialist training in breast cancer. And after that I worked in Adyar Cancer Institute and trained further in breast cancer surgery, and I have been back to England again doing an oncoplastic fellowship, returned back in 2007, and ever since 2007 I've been practicing in Chennai. So in 2007, when I returned back from the UK, I realized that in India we are seeing a lot more advanced cancers with poor outcomes, and this is because of the lack of awareness and lack of proper diagnostic facilities, and that is why we started Chennai Breast Center. Now, Chennai Breast Center is unique in the sense that it is a one-stop breast center. So like in another place, a patient would have to go and see the doctor first, the doctor orders a test, and they'd go to another center or a diagnostic facility or hospital to get a mammogram and collect the results and come back to the doctor again. And the doctor decides that a biopsy needs to be done, then they have to find out where a biopsy is done and then go again elsewhere to do a biopsy. The turnaround time could be 3 to 4 days with a lot of running around and a lot of expense involved. So, but in our center, it is unique in the sense it is one stop where a patient comes to see me, I consult with them, and then immediately we get a mammogram done and an ultrasound done. And if the patient requires a biopsy, they are counseled and the biopsy is done, all with a turnaround time of close to 30 to 45 minutes. At Chennai Breast Center, we are equipped with digital mammogram. So as soon as a mammogram is done, we are able to view the mammograms in a high resolution monitor such as this. And if you ask me what is the difference between the digital mammogram and an ordinary mammogram, in a digital mammogram the films are acquired digitally and therefore the resolution and the clarity is much better. Whereas in an ordinary mammogram, you have to, just like in those olden days camera, you have to buy a film roll, load it, and then take the picture and then develop it. And if you have to make prints out of it and convert it into a computerized image, you have to scan it. In all this process, we lose information. The clarity and the resolution could be lost. And it also, digitally also, we can actually do a lot of post processing and enlarge the image, increase the contrast and do all these post processing, which is not possible with the ordinary mammogram. So the number of retakes is less, the compression and pain is a little less with digital mammogram. The turnaround time is very quick. With the digital mammogram, you don't have to wait to develop the film to see if it's adequate every time. You can do it very quickly, and most of these machines are now automated. So the clarity is much better. Another important feature with digital mammogram is that you can actually archive it. So you can store any number of digital mammograms, and if you want a second opinion, you can email it, you can retrieve it later and then compare it with the current study. So this comparison is very important for seeing if there is any change in the disease. Comparing with the previously done mammogram, if available, is very important to pick up a change and therefore a new development like cancer. So look at this mammogram, this shadow was seen in 2011, 2 years earlier, and we didn't think it was important, so we didn't do anything about it. But this patient had a subsequent screening study 2 years later, and we found a new change here. So this particular change has actually developed more densely, and this in fact turned out to be a cancer. It is very small, and this was biopsied, confirmed that it's cancer, and this patient had a treatment wherein we removed only this part and saved her breast. This is very important to compare and see. If you didn't compare, it's likely that we would miss this lesion. So we should compare and see if there is any change from one to another. So all this is possible with the digital mammogram. Besides mammogram, at Chennai Breast Center, we are also equipped with state-of-the-art ultrasound machines such as supersonic, and we also have facilities to do ultrasound guided core needle biopsies, and we are equipped with a multi-care prone table biopsy system which is capable of doing prone table stereotactic biopsies. So, all these are state of the art facilities to perform breast cancer diagnostic and screening work.